Greetings and welcome to ME 180. This week we're going to discuss the background on drug discovery. We're going to discuss the drug schedules and the routes of administration of medication. So, thinking about the history, uh, therapeutic drugs have long played a major role in increasing average life expectancy in the United States in the last century. However, while many of the drugs in use in the last 50 years or more have been of synthetic or semi-synthetic origin, the pharmacopoeias prior to that period were natural. So we get a lot of synthetic medications now, but before uh, the pharmaceuticals were of a natural origin, so plants and what have you. The medical value of plants has been recognized by almost every society on this planet. In the 19th and earlier centuries, natural product extracts, particularly those that were derived from botanical species, provided the main source of folk medicine. Um, in the latter part of the 19th century, biologically active organic molecules began to be isolated in relatively pure form for medical use. An example, salicylic acid, or what was the precursor of aspirin. It was isolated in 1874 from willow bark. More potent painkillers such as morphine, codeine were isolated from the opium poppy. The anti-malarial agent quinine was separated from china bark, or what's called cinchona. The leaves of the purple foxglove plant provided an excellent source of digitalis that was purified for use against heart disease. Now, there are a number of other examples that we could go into, but then we would just be spewing a lot of stuff. So let's move along. Although synthesis of the first synthetic pharmacological drug, aspirin, occurred in the latter half of the 19th century, it was not until the early 1900s that the recognition of aspirin as a universal pain reliever was realized, and this discovery spawned a whole era of therapeutic agents. It wasn't until the recognition of that many infectious diseases were caused by microorganisms that the real impetus in the development of therapeutic agents, both natural and non-natural, began to occur. Concurrent with the discoveries in medical microbiology were major advances in synthetic organic chemistry and medical microbiology, biochemistry that provided further momentum in the area of therapeutic agents. Synthetic sulfa drugs, the natural antibiotic penicillin from Penicillium notatum was discovered by Alexander Fleming. The semi-synthetic antibiotic tetracycline produced from natural chlorotetracycline elaborated by Streptomyces aureofaciens was discovered by Benjamin, or advanced by Benjamin Duggar. And the anti-tubercular aminoglycoside streptomycin from the Streptomyces griseus was Salomon Wakeman. These were all landmark discoveries of the 1930s and 40s. The importance of vitamins and diseases caused by their deficiencies were also being uncovered during this period. So that gives you a little view of the history of medications within the 1900s, 18 to 1900s. Now, having said that about discovery of drugs and what have you, there was one that was discovered by a doctor, and it was actually a psychogenic drug. It's LSD. And it was he was researching and discovered LSD. Now, let's put drugs in their perspective schedules, and by schedules I mean their levels of control. So we have Schedule 1, which is controlled substances. Substances in this schedule, they're not currently accepted medical use in the United States. They have a lack of accepted safety for use under medical supervision and high potential for abuse. Some examples of these would be heroin, lysergic acid dimethylamide, which is LSD, marijuana, peyote, methaqualone, and 3 and 4 ecstasy. So there's 2 types of ecstasy. Now, having said that, we are today, many states are legalizing marijuana for medical use for specific things, such as glaucoma. Schedule 2 and 2N, controlled substances. You have, in this schedule, high potential for abuse, which may lead to severe psychological or physical dependence. Schedule 2 narcotics include Dilaudid, methadone, meperidine, oxycodone, Fentanyl, and other Schedule 2 drugs could be morphine, opium, and codeines. Examples of 2N stimulants are Dexedrine, Adderall, Desoxyn, and Ritalin. You could also have in Schedule 2 phenobarbital, glutathione, and amobarbital. Okay, you have Schedule 3 and 3N, which are controlled. Excuse me. They have a potential for abuse less than the substances in 1 and 2. They may lead to a moderate or low physical dependence or high psychological dependence. Some of these examples, they're combination products containing less than 15 milligrams of hydrocodone per dosage unit, such as Vicodin. Products containing not more than 90 milligrams of codeine per dosage unit, Tylenol with codeine, and let's see, what was it? Buprenorphine. Examples of Schedule 3N, you have bensphetamine, phendimetrazine, ketamine, and anabolic steroids such as testosterone. Excuse me. Schedule 4 have a lower potential for abuse relative to the substances in Schedule 3. Some examples of 4 are Xanax, Soma, uh, Clonopine, Transine, Valium, Ativan, Versed, Restoril, and Halcyon. Now, Schedule 5, again, is lower potential for abuse than Schedule 4, and consists primarily of preparations containing limited amounts of certain narcotics, such as cough preparations containing not more than 200 milliliters of codeine per 100 milliliters, or 100 grams. Robitussin AC, Phenergan with codeine, and ezogabine. Okay, we've gone through the schedules. Let's talk about the route of medication. Medication can be given in many different ways. Some of the examples are oral route, which is swallowed by mouth as a pill, a liquid, tablet, or lozenge. Rectal route, of course, would be a suppository inserted into the rectum. Intravenous route would be injected into the vein with a syringe or into an IV line. Infusion is injected into a vein with an IV line and slowly dripped in over time. You have the intramuscular route, or IM, which is where you inject into the muscle through the skin with a syringe. We have topical route, which is applied to the skin, sort of like a cream or something. Enteric, which is delivered directly to the stomach with an IG tube or a J tube. Nasal sprays or pumps that deliver the drug into the nose. Inhaled, which would be inhaling through a tube or a mask, lung medications. Otic, drops into the ear. Ophthalmic, drops, gel, or ointment for the eye. Sublingual, under the tongue. Buccal, which means that you hold it inside the cheek. Transdermal, such as a patch on your skin. And subcutaneous, which would be injected under the skin. Some routes may not be safe or effective. They can be unsafe due to certain health conditions, dehydration, inability to swallow, or some other factor. Proper preparation must be taken to prevent complications from the route of administration. For example, we clean the skin and use sterile syringes when we inject IV or intramuscular. And this is really important for preventing any type of infection. I hope this has helped you this week, and I will see if I can find some more stuff to post for you. Enjoy your week. We're getting very close to the end. It won't be long until we're at week 10. This is starting week 7, so it's 3 more weeks after this one. Have a great day and happy studies.